giving the opportunity this morning to give a presentation on this study I did as part of my master's in child and adolescent mental health program. So get the pointer, please. All right. So as an outline, we look at the background and justification. The aim.
We are now doing our first AGS. You would realize that psychiatrists in Ghana were almost extinct. There was a time that for the whole country, you had numbers that were under 10. And in those days, the burden of work on them was extremely high. At that time, they had a Ghana Psychiatric Association. But because of the burden of work and the challenges at that time, we couldn't stand. Somewhere, let's say between 2010 and 2013, we tried to revive it, but unfortunately, it wasn't successful. But somewhere around 2018, I think around February 2018, there were a number of welfare issues that brought members together. Around that time, the numbers of psychiatrists in Ghana had started going up. And at that meeting, I think somebody voted for the idea for us to put together the association again. So that was the inception of it. In 2018, we put in place an interim management committee, of which I was the chairperson, and we put together the necessary legal documentation, a new constitution, and somewhere in June of 2019, we were able to validate the constitution and then birth this Psychiatric Association of Ghana. You can say the second republic of. So that is how come. And like we do usually, it's a yearly thing, but we are very new, young association, and also COVID came and then it had its own challenges with all the restrictions and gathering and things like that. So that is how come we are now having our first AGSF.
Okay. And so can you
professional groups, it's meant to be opportunities for us to sort of deliberate on issues that affect the profession and association, discuss issues that has got to do with our professional work in the States, and then also look at scientific papers that are being churned out and discuss them and see how these things can contribute to promote the good outcome in mental health, basically. So that's what I would say.
Would have been celebrating his 4th anniversary as a prisoner to the guava tree. These are the issues we face as a country, and these are the problems we are confronted with as an association to address. There are many like Baba who are challenged by financial difficulties and cannot access medical care. There are others who have had to resist the idea of psychiatric help because of the stigma it attracts. You must, as an association, seek to make these issues a priority to shape policy discussion. The COVID-19 pandemic has had a major impact on people's mental health. We know that many people have been affected, including those with pre-existing mental health conditions. A survey in 2020 conducted by WHO showed that services for mental health disorders and other related disorders was significantly disrupted during the pandemic. During the World Health Assembly in May 2021, WHO member states recognized that support for and commitment to quality mental health services might be scaled up at all levels and endorsed a comprehensive mental health action plan 2013 to 2030. The Assembly urged member states to develop and strengthen comprehensive mental health services and psychosocial support as part of universal health coverage, with a particular focus on improving understanding and acceptance of mental health conditions. As a major stakeholder in the delivery of mental health services, your role in supporting Ghana to achieve the deliverables in the comprehensive mental health action plan is critical. As clinicians, researchers, and academics, leading context-driven, evidence-based, innovative approaches in mental health must be a priority. WHO pledges continued support for mental health in Ghana. Collectively, we can change the narrative for the well-being of the Ghanaian populace. In conclusion, I'm grateful for this opportunity to add my voice to these critical issues of inequalities in our mental health delivery. I'd like to wish us all fruitful discussions that will shape reforms and transform mental health delivery in Ghana. Thank you for your attention.